Hello, everybody. I'm just gonna start. So anybody that watches the, um, hello, everybody. My name is Chagai Reiner. From AutismEssentialsIsrael.com. I manage this group together with my wife, Shira, um, and I'm a father of 4 children, 3 boys and a girl. Our 3 boys have a genetic disorder which has led to autism for all 3 and drug resistant epilepsy for 2 of my 3 boys. Um, and our story begins with finding a cure for, well, actually, not finding a cure, but trying to make our quality of life a little bit better so we can get to maybe balancing the epilepsy of our eldest child. Let's go a little bit backwards, okay? So today we're going to talk about stem cell therapy, different types, who it's for, and where to get it. Now, our story begins with my wife. She studied to be a nurse. She's a registered nurse today. And when she was a student, one of her lecturers was talking about cord blood and how he believes it's going to be very important in treating neurological conditions. This kind of resonated with her, and years later, when our eldest boy was diagnosed with autism, and just a few months later with the epilepsy, um, she was pregnant with our third child, and somehow at the same time there was also she was working as a nurse in the what's it called, the baby unit, the NICU, and the neonatal care unit. And she got an invitation as a nurse to attend a convention where Professor Joanna Kurtzberg had been invited to speak here in Israel, and so this connected with what she heard from her education years earlier, together with having a child that's just diagnosed with autism. And so we preserved our third child's cord blood when he was born, hoping to give it to Dolev, our eldest, in Duke, in the States, hoping that it will be improving his verbal skills, his communication. And then he got diagnosed with epilepsy. It's a very violent type of epilepsy. He has he had several different types of seizures, and he would not really respond to any medications. When he was 5, he had a seizure in kindergarten. He fell off a slide and hit his head. We rushed to the ER. We had already been registered for the clinical trial, the expanded access protocol in Duke with his brother's cord blood. But when we rushed to the ER when he was 5, the neurologist in the ER, he said that our main neurologist was giving us the right treatment, that we just need to be patient and try more medication according to what the main neurologist was prescribing. And he said that if he reaches age 6, then he can have a VNS transplant. That's a type of pacemaker for epilepsy. Okay, so it's a mechanical device that they implant under the skin to send electrical pulses to the nerves, which might help control seizures. So he said this if at the beginning of this explanation that signaled to us that our son was not with very good chances to survive to reach that age. He basically gave us an expiration date on our son's life. We had to reach this stage at any cost. We started sending emails to Duke. What's going on? We have been waiting 2 years to hear something from Duke. And all you get when you send Duke emails is an automatic response. So we had been waiting for 2 years to maybe get a representative telling us that we can schedule a conversation with the medical consultant to see if we can get into the program sometime in the future. We realized we're running out of time and we need to find alternatives. His brother's cord blood was small. That's part of the issue. You get a small unit. It's a very limited amount of time that you can use it effectively. So we started sending emails to people that we knew here in Israel that are connected to cord blood banking companies abroad. We started sending emails to research centers that are similar to Duke in other countries. We found some that will treat autism, but they won't treat a child with autism if he has epilepsy. And we searched and we searched, and we were almost on the edge of giving up on it when we remembered somebody we knew who went to Panama. So there's a clinic in Panama, Stem Cell Institute, that's very old in this field, and they will provide treatment with placental or umbilical cord mesenchymal stem cells. Now these are not exactly cord blood, but the medical principle is very similar between the two different treatments. You use a biological factor, and it does something. Somehow it helps with improving communication with autism. So one leading theory at the moment is that there's a heightened level of inflammation systematically in children with autism. It sort of explains why children with autism are at a higher risk for other illnesses like epilepsy or arthritis or things like that. They have a higher level of inflammation that their body is not very good at clearing. I think there are other things, other theories that are also sound that they make sense, and it might be a combination of things. Anyways, so cord blood, the stem cells in the cord blood, or the lymphocytes in cord blood, or the mesenchymal cells are pretty good at clearing away inflammation, in modulating the immune system, and this somehow helps children with autism get better with communication. We didn't really know most of what I'm explaining at the time. We're just sort of going for it. We found a place which is closer to us. Swiss Medica is the company, and we went to Moscow for our first treatment for Dolev, my eldest, in March 2019. So a little bit over 3 years ago. We went on a flight. We got to Moscow. We got to the clinic. We explained to the clinic that all our doctors said not to go. Everybody told us that it's dangerous, except we sort of realized that they don't really know what they're talking about. They haven't actually researched this topic. There are stem cells which are risky. Pluripotent stem cells, embryonic stem cells are not something that you want to put into your body. But mesenchymal stem cells are different. They do not engraft, they do not multiply once they are injected into the body. They die out, but they produce curing factors that help the body. And with autism, they help clear this inflammation in the brain or the gut or whatever they do. Okay, I'm just a father, I'm not a biologist. Sorry if I get some of my facts wrong. That's not the point of this video. So the stem cells go into the child's body, they clear away inflammation and help reduce gaps. Now what happened to us in March 2019, we had a child going on a plane. He had about 8 seizures a day. He was on 2 different drugs at the time, which weren't helping at all. And about 2 weeks after we came back, I sort of realized we haven't been in the ER in like a week or 2. We haven't been in the ER since before the treatment in Moscow. Now that I think about it, I haven't really seen him stare into space or have one of his tonic-clonic seizures. I haven't seen that in a while, not since we went to Moscow. So we started looking at him. We realized he wasn't having 8 seizures a day. He wasn't having any seizures a day. We went to the neurologist. We scheduled an EEG. The EEG was clear for the first time in his life. His EEGs was crazy lines, and then here you have nice, clean, or orderly lines. Jaws drop. Now another thing happened a little bit before that. About a week after we came back from the clinic, we started seeing signs that the communication was in fact improving. This child before treatment, he was drinking from a baby bottle, still in diapers. He was nearly 60 years old at this stage, 5 and 8 months. Still drinking from drinking from a bottle, still in diapers, doesn't speak, doesn't do anything independently, basically, very passive. So we realized at this stage he started speaking more independently. We were working for a very long time on getting him to say, "I want," and add another word. He would only copy us to get what he wants. Suddenly he points at McDonald's and he says, "I want a meal with hamburger and French fries." Now, this is a 7-word sentence, something like that. And he says it on his own initiative. And we're like, yeah, but we were working on this skill before, right? So at first it's not exactly clear that you are looking at a change that's very significant. But these things add on and they add on. And we had, after a month, a very clear picture that something was very different, okay, within a month. Let me put it in numbers, okay? We were at the time, before going to the treatment, having an assessment to get Social Security. You have to renew the assessment around 60 years old here in Israel. So we did an assessment for him before the treatment. He was at 5.5-year-old. He was about 1.5 years in general function. And then after the treatment, about 2 months after the treatment, we did another assessment, and he was at 2.5 years of general function. Okay, so he skipped a year of development in communication, motor skills, everything all together. He skipped a year, closed a year's gap in about 2 months. So it was pretty crazy. We're very lucky to have these tools to measure that this change is happening to him. A clear EEG and a developmental neurologist assessment saying that something is actually different. He was supposed to go to a special needs school for intellectually challenged children, and then this change within 2 months allowed us to appeal and put him into another year in preschool. And at this stage, he goes to a regular school in a special education classroom. So he's partially integrated into the regular classes and does activities together with other kids that are of normal neurological development. And it's been a crazy 3 years. So what we're talking about right now is the difference between the two different treatments I've mentioned: cord blood and mesenchymal stromal cells. So if you're lucky enough to store cord blood, then it would be a good idea to use it. But it's not necessarily easier to use, and it's not necessarily more effective to use than the other treatment. Right now, both of these treatments are in research around the world in different medical research centers. Professor Kurtzberg is testing the effects of the MSC, the mesenchymal stromal cells, from umbilical cord on children with autism. She just finished the stage 1 of her research and is in the middle of stage 2. So we don't really have results yet on the efficacy of MSC from Kurtzberg to compare with cord blood, but they both have a similar effect from what we've seen, and it's possible that MSC is even more effective, and it's actually easier to get than with cord blood, because cord blood you have to store it at the birth of your child or with a sibling, and sometimes siblings are not a match, and sometimes the cord blood is not enough, or it's been infected in the process of storing it, or it's been infected in the process of thawing it. So cord blood is very complex. Now you have some risk with dealing with biological materials all the time. So even with MSC, you have the risk of infections, of the material getting spoiled, but it's easier to make sure that you have a large amount of material to provide to several patients with MSC than it is with cord blood, because you can make MSC out of a lot of tissues. You can get it out of bone marrow, you can get it out of the umbilical cord, the placenta. I've heard about amniotic fluid being used for it, fat. You can do a liposuction and produce MSC out of that, skin cells even. So you have MSC in several different tissues, teeth. Okay, so you have several different tissues that you can produce stem cells from, and by giving this material back to yourself, or by producing it from a material that can be given to anybody, like the umbilical cord or placenta, you can treat a lot of people where it's really difficult with cord blood. So here's the thing. They take the umbilical cord and the placenta from a woman that gave birth with an elective cesarean section. That's to make sure that they have the time in advance to do a background check on the woman, to test that she doesn't have any infectious diseases, and then that she's young enough. And the cesarean section is also gives you better chances to have sterile conditions, so you don't introduce infections into the biological material that you're trying to collect. Okay. Now, here's the beauty about the placenta, what's called the perinatal tissues, the placenta, the umbilical cord, and amniotic fluid. They are neutral in terms of HLA genetics. You don't have to do HLA matching between these tissues and and the person that's receiving them. Whereas bone marrow, you'd have to have 100% match. It's very difficult to find. So it's not. So you take it from yourself. You don't get bone marrow from donors. But the placenta you can produce from one placenta or one umbilical cord. Let's say 1,000 units for transplant, and you can give this to anybody that has maybe the same blood type. That's the most that you actually have to check, right? And then they test in clinical trials to see if this is a safe treatment, and all the clinical trials, at least the ones that I've read and the ones that I've received from doctors that I've been speaking to, show that this is a safe procedure. It doesn't, these cells don't engraft, they don't pose a danger to become cancer by multiplying endlessly. That's basically the risk with the embryonic stem cells. That's why we always tell people to avoid clinics that deal with that kind of treatment. I only know one that does that at the moment. Most clinics that deal with embryonic stem cells are closed because people got hurt, people died. Okay, but with MSC, you don't get that. They're safe. We've done 4 treatments with MSC and 1 with cord blood, which went to my 3rd child. Okay, eventually he was also diagnosed with autism, and he received his cord blood in the clinical trial in Israel. We are trying here as an Israeli group. You'll see most of the content in this group is in Hebrew. We're trying to push the stem cell research community in Israel to research this treatment for autism as well. There are a few companies that deal with stem cell research, but procedurally, bureaucracy is a little bit difficult. They don't want to deal with getting the approval for treating children, and we have companies that deal with this, with the same materials that we're getting in first in Moscow and recently in Serbia with the COVID condition in the state of the COVID in Moscow, in Russia, and then the war. The clinic there just closed, but the same company has another clinic in Serbia, which has not been affected by the war up north, and that's where that's where we've gone last time, and that's where we're going again this summer for Dolev's 5th treatment, and Nevo will have his first treatment of MSC, so his second treatment with the regenerative medicine. Okay, now. This is just one clinic. I've also mentioned the clinic in Panama, Stem Cell Institute. We're also working with a clinic in Mexico, World Stem Cells Clinic in Cancun. They're also very good in my opinion. We've been speaking with several clinics in Mexico and very unsatisfied with what's going on over there, except this clinic. There are other clinics that might be good, but this is one of the only ones in Mexico that has the ability to produce cord blood mesenchymal stem cells with all the necessary equipment. There are other clinics other labs that produce this type of treatment and sell it. They don't do it properly. We've been hearing bad rumors and bad reports from people that have been there, that there's issues with the way that they produce stem cells. There are issues with the quality. They don't have the same quality check that a big lab with more resources has. So it's more expensive to go to a lab a clinic that has its own lab, rather than a clinic that buys its cells from a lab that doesn't have a clinic, but it's not the same quality. So you don't want to go on the cheap when you're treating your child with a biological treatment. It's very important to mention. We've been looking for clinics in Europe, so we found this clinic in Serbia. There's a clinic in Poland, which is okay. They're also working in a method that in Poland there's a central cord blood bank in Warsaw that sells its material to clinics around Poland. So we've found a clinic that has recommendations. I'm not sure that I want to send clients there, and I haven't actually sent any clients to Poland because the bureaucracy there is a little bit complicated and unattractive to deal with. You have to send the letter of consent, request to have a Helsinki committee look at your case and send it for approval via snail mail. So that's very unattractive, but it's an option. There are other clinics that deal with bone marrow, which we don't recommend, but that's an option. In Vienna, for example. There's a clinic in Georgia, which I really don't like. They don't seem to be working with proper medical procedures, but they're one of the only places in the world that's currently accepting cord blood. We've been working on getting the clinic in Serbia to accept cord blood for treatment. It's been very difficult, but we're making some progress there, so that might be an option. And then we're going to Asia. So in Asia, there are clinics in Thailand, in Vietnam. India has a lot of clinics. Clients from Israel don't want to go there. Parents from Israel are not interested in Asia, especially since we have a nice clinic in Serbia, which is just 3 hours away. I've been hearing rumors about something about Slovakia that I need to check into. If anybody knows a clinic that I should look into, I would love to hear details and why you recommend this clinic, so I can look and give other options to people that come for me for consultation. Now, I've mentioned in the video I'm not a biologist, I'm not a doctor. My wife is a nurse, so we have a little bit of a better understanding from her side about medical procedures. But we do not give medical consultation. We just give our experience and help people reach a decision, help people apply if they're having trouble contacting places that we have contact with. From Israel, we help parents translate, help using both our English and Hebrew skills to make the process easier to get to. And you can contact us for consultation if you want. We do a lot of volunteer work in this field, so if you want, you can contact me on Messenger, WhatsApp, or through the Facebook posts and ask questions. I will answer. If you want a face-to-face session, that's something that we charge for. And we've been sending a lot of patients to Serbia. We're very satisfied with their service and their products. They're not perfect. Nobody's perfect, and there are some issues also with the clinic in Serbia sometimes. But for most of the clients, we're very satisfied. And we're satisfied with the clinic in Mexico. I think it's a little bit better than the clinic in Panama, despite having a few less years of experience. It just has enough. I think I like Dr. Ortiz, who runs the clinic. I think he's very professional. Does anybody have any questions for me? Please write in the comments. I'd like to talk about what we're doing here in Israel, maybe. Here in this group, again, as I said, it's a group for Israelis. We'd like you guys to share your experiences if you feel that you are comfortable with it. It doesn't have to be just about autism. We've been sending patients with Parkinson's, with digestive problems, with the pulmonary problems. All sorts of issues can be treated with stem cells. Let's talk a little bit about the biology behind it. I hope I explained it well. So you have the stem cells, they're being put into your body with IV infusions, with inhalations, nose drops, injections into the muscle or into a joint if that's what you want to get treated. They get injected into your body or put into your body in one way or another. And then they release, they start dying. And in this process, they release exosomes. They release these when they're alive. They sort of have an inbuilt function where they home into areas that have chemical signals of inflammation. And they will release these exosomes, these little particles of themselves, that they are proteins, mRNA, or mitochondria. They submit these to cells around them and help to fight the inflammation or to rejuvenate weakened cells by adding the mitochondria. There's all sorts of functions that various stem cells can do, or MSC can do. And we've been seeing a lot of progress with our children, with the children that we're sending from other families. Let's talk about the progress that my son did. So the last treatment we did was last summer in July. Dolev had, I think it was 4 million cells, 2 million of placental MSC, 2 million of umbilical MSC per kilogram, so 4 million cells per kilogram inserted in IV, and he had nose drops of exosomes every day for 5 days, 4 days actually were there, a speech therapist was also working with him every day. After the treatment, there was like a few weeks where it was difficult for him. He had just undergone maybe a traumatic medical intervention. He had cells in his body which were affecting his neurology and making him go a little bit crazy. This is something that you see with stem cell therapy. It sort of energizes the kids. It gives them the brain connectivity becomes better, so they are adjusting to how things look with this new light that they were unable to see before. So they're going through a little bit of more hyperactivity. He was very anxious at the time, afraid of things that he wasn't normally afraid of, maybe crying when from nothing that we could tell what it was. A little bit of stopping, a little bit of regression in speech, and then boom, he started. The first thing that was really visible, he was. We usually had to, bathe him, and then he goes into the shower and says, "No, I'm showering alone. I don't want my brother and sister to come in into the bath with me. I take a shower." He goes into the shower, he closes the curtain, he starts washing himself using the soap, guiding him a little bit, but he's basically doing everything on his own and demanding privacy, which was completely new. He was very passive in bathing. right now I can't remember. There was another thing that was also very dramatic, also with independence. He started making food for himself, taking something from the fridge and warming it up in the microwave and making himself a plate of stuff that he likes. He became a little bit more adventurous in food. He's like, I want to taste this, I want to make that. He sees some kind of video on a video game where they make a fried rice or something. He says, I want you to make this for me. Gets a little bit upset that I can't make fried rice just because he wants it, but still, it's curiosity with food, and he's a very picky eater, but then he's willing to try new things to see how they taste. He doesn't like it, but he will try. You can't get these kids to try. Suddenly you have this kid trying. That's really incredible. And over time, his academic skills are improving, and his vocabulary and communication is improving. So in general, he's been 3 years seizure free. He's been almost 3 years without medication. We can't say that this has no effect on his ability to grow, but after each treatment, he's become more and more like he's closing developmental gaps, and it's just been a crazy ride. It's really wonderful. We're really happy to see this happen to us, which is why we've been encouraging other parents to learn about this topic. We've been writing up information on a website. We've been posting information on this Facebook group recently, sharing our stories, exposing ourselves, which isn't always easy, exposing our child's private life, and that's also has a lot of it gives us moral concerns, but we feel that it's very important that people know that this happens, that this is possible. And we've been working to get people from Israel mainly. First of all, because we can serve these people better by helping out with our English, but also a little bit from around the world. And mainly from Israel, because we want this treatment to be available here. We believe that by sending patients abroad, by showing that this treatment worked for these children, more and more doctors who are exposed to these children's sudden improvements in closing developmental gaps will get them interested in this topic, will get them less suspicious, will get them to maybe support the research that's being done here in Israel and get into it. And we've been pushing our neurologists to Shira, my wife, she's a nurse, and she's actually a colleague of our neurologist. So she's pushed him to open up the cord blood trial that he has, and that our son participated in, and to push it further. They're actually rehired her as a nurse for the cord blood bank. She was working in another hospital until recently. And we've been searching for other researchers here in Israel that are interested in stem cell therapy for autism. And there are two other researchers that are showing some kind of progress into getting different types of treatments in this field for autism. One of them is looking to do stem cell therapy like they are doing in Serbia. So we've made a sort of connection between them. And another one, which I'm not directly contacted with, is doing just exosomes, but it's not exosomes like the ones we're getting in Serbia. It's something more advanced. They're doing some kind of manipulations on the cell and on the exosomes themselves to get specific exosomes. Ones that are specifically in tune to helping a specific type of autism. So it's really cool, very interesting. Um, I'd like to answer any questions if anybody's watching and has questions for me. I'm here now to answer. Otherwise, I think we're done. I'm gonna share this video with the different groups that have invited people from to watch. There are other English speakers coming into our group, so this is for them. Basically, if you want to get to stem cell therapy for a child with autism or epilepsy, you're welcome to contact me, and I will give you contact details of the stem cell clinics that I recommend, or you can do your own research based on what you've heard in this video and contact any clinic that you feel comfortable with. We'd love to hear people share their experiences to make other parents more comfortable to go into this treatment, even if it's not a clinic that I recommend, even if it's from a clinic that I recommend not to go to. It's fine. You can share. This group doesn't, I don't prevent people from sharing. Just as long as you are respectful of everybody else in this group, you're welcome to do it. So please do. I have a question. When will the trial in Israel be done? Okay. That's a very good question, Chad. I wish I had a clear answer. Right now, what's going on is the cord blood trial in Israel is still on stage 1. Most of the kids that were supposed to get the treatment started have, but there are some, it's just 30 kids that haven't got their cord blood yet, or the placebo. They're getting both. Okay, so each kid is supposed to go through 2 infusions. And the problem is that the research is dependent on the hemato-oncological department to supply a nurse that will do the infusion, and they are busy treating kids with cancer. So every once in a while they get a window where they can treat a child in the that's registered in the program, and they haven't finished stage 1 yet. So Shira joining in the cord blood bank was thought to go in and do infusions, and she's not going to, but they are going to hire another nurse. She's been pushing the hospital to invest more in this program because cord blood is very important to preserve. People need to know that they need to preserve it. It's also a way for the hospital to make money. So they were private before, and now it's gone back into the hospital is going to manage the cord blood bank. They've removed the private company that was handling it, and they're going to invest more money into it, more resources into it, and hopefully get to stage 2 soon. We are hoping that this will allow the hospital, once stage 1 is complete and the paper is released on it, to expand to other types, not just going to stage 2 with cord blood, but also to start looking into MSC. Anyways, by the time that Israel will be able to accept patients from abroad, foreign, medical tourism from outside in, it will take a few years at least, unfortunately. Let's be optimistic and say in 5 years we can accept people from Europe to come into Israel instead of the other way around. But for now, we're just doing what we can in order to push Sheba Medical Center, or Stem Cell Medicine Company, or Cell L Company. These are the three companies that we're investing our time in trying to push them to get the treatment ready for Israel. So that's it for today, I think. I hope this is going to serve the English speakers coming into this group. If anybody is coming in and they don't understand the language, it's okay. You should have an ability by Facebook to click on translate and show the translation. I've seen that sometimes it's automatic. So you should be able to see it in your own language and learn from other parents going in. I do want to share that we do have a collaboration with Swiss Medica to give Israelis a discount if we manage to get big groups. So a group of 20, we're managing to almost close it this summer. We actually have we need to make sure that everybody that said that they want to is going through the process, is able to pay for it. It's not cheap. We're talking about a 3,000 euro discount if we manage to close the 20 people group. I actually have 18 or 19 again. I had more than 20. Now I'm back to 19. And we're very excited, and I believe that in August we'll be sharing videos from the clinic in Serbia, and people will be sharing their experiences, and hopefully this will allow other parents to feel more comfortable taking their children to stem cell therapy in other countries, or hopefully it's available in your country in a safe and quality program. So that's it. I think I bid you good night. Thank you for being here.